Hey everybody, I hope you had a good holiday. Uh, so you remember we were talking about the skeleton, right? Bones. And the skeleton is divided into two parts, axial and appendicular. Axial skeleton includes the skull, thoracic case, and vertebral column, right? And appendicular skeleton includes the upper extremities, these two, and lower extremities, these two. Okay? And in last class, I talked about the skull bones and the hyoid bones. And I mentioned that the bones of the vertebral column are divided into cervical. How many? 7. Okay. Thoracic vertebrae. How many? 12. Lumbar vertebrae. 5. And sacrum. 1. And tailbones, coccyx. Right. So first we'll see the cervical. Among 7 cervical vertebrae, upper 2, that means C1 and C2, are different than other 5. Other 5 are very similar, but number 1 and number 2 are different. So we'll see. Number 1 or C1 is called atlas, okay? And number 2 or C2 is called axis. C3 to C5, they're very similar, okay? But these two are very different. So if you see a typical vertebrae, most of the vertebrae are like this, okay? That's why we say this is a typical vertebrae. A typical vertebrae has a body in the front, so this is how in your body, okay? How it is in your body. The body part is in the front and back part is called the arch, okay? So this is the body and this part is called what? Arch. Now arch has a number of structures, you see, going to different directions. These two are going like this. These are called transverse processes. So going like this, transverse processes, okay? So 2. One is going backwards, this one. This is called the spinous process, 1, okay? Spinous process. So how many transverse processes? 2, going this way, right? And spinous process 1 going backwards like this, okay? And the area between the transverse process and the spinous process, this part and this part called lamina, okay? Lamina. And the structure or part that is connecting the body to the arch, that part is called the pedicle. Okay, so we'll see that. And then you have 2 superior articular processes. You see these 2 going upwards. These are called superior. Superior means above, articular processes, these 2. And there are 2 going downwards. These are called inferior articular processes. Okay, so now let's see. So this is a typical vertebrae, right? It has a body and an arch. Arch has a number of structures, right? 2 processes are going like this. Those are called transverse processes. One is going backwards. That is the spinous process, okay? And 2 are going upwards. Those are called superior articular processes. and two are going like this, downwards, inferior articular processes. Make sense? Okay. And this is called the vertebral foramen, through which the spinal cord, a very important structure, right? Spinal cord passes. Now, this is another vertebrae. So if I put this together, you see what happens. Anybody? These two are called what? Superior articular processes, remember? So superior articular processes of the vertebrae below articulates with the inferior articular processes of the vertebrae above, like this. Fits like this. You see? This is the superior articular process, right? And this is the inferior articular process. This is one vertebrae, this is another vertebrae. Make sense? And they get attached like this, very nicely. Surfaces are flat, so very nicely fit. So superior articular process of vertebrae below articulates with the inferior articular process of the vertebrae above. Make sense? Like this. So two. So that's why you see here these two and these two very nicely fit. Make sense? So that's how the vertebrae are attached by articular processes. That's why those are called articular processes. Articulation means joint. Articular, right? Articulate. You know that we articulate the sentence, right? So articular means joining. Okay. Now, this is the vertebral canal. What is the difference between a vertebral foramen and a canal? If I show you one vertebrae and ask you what is this? Vertebral foramen. Okay? If I add more, this becomes a canal, vertebral canal. Okay? So this is the canal and one is a foramen. Actually same thing. Right? When I add more, it becomes a tunnel. Right? So that's a canal. Another thing here, there is a passage this way that I will show you here. You see here? I showed you in last class. It is still here. So this way, transversely, that is called the intervertebral foramen. So intervertebral foramen is this way, vertebral foramen is this way. Make sense? Okay. So those are the parts of a vertebrae. Where is that? Okay, now I said that C1 and C2, they are different than other vertebrae. So how they are different? Okay, so I got it. So this is C1. First cervical, the topmost vertebrae, right? So the skull sits on it. Make sense? The skull sits on it. And this is called the atlas, C1. This is the only vertebrae which doesn't have the body. Body is missing. You see, there is no body. Since the body is missing here, this vertebral foramen is very big, right? Because no body here. So vertebral foramen is what? Big. Yeah. No body, large vertebral foramen. Make sense? Okay. And this vertebrae has two arches. You see, like St. Louis arch, like this. This is one arch. This is another arch. So if I ask you, this is what? C1, which is also called atlas. it doesn't have a body, no body, right? But vertebral foramen is big, large. Make sense? And how many arches it has? Two arches. Okay? So if you see this, this is C1. This is C2, which is called axis. Why this is called axis? Because you see this is the only vertebrae, C2, which has this structure. See that? Sticking upwards from the body. It's the only vertebrae that has this structure going upwards, finger-like structure. That is called dens, D-E-N-S. So, if you see that, dens, that is C2 or axis. Okay? Now, why this is called axis? Because around this structure, your head rotates like this. So what happens is, see, this is C1, this is C2, this dens goes into C1 like this, and this one rotates around this. Make sense? Like this. It is like this. This is the dens, this is C1. Make sense? See, you rotate your head. So that's why this is called the axis. Okay? This vertebrae. These two are different than other vertebrae of your body. Now, if I see other 5 cervical vertebrae, C3 to C7, you will see what? This is C3 to C7, one of those. They are all very similar. Now, how you will know this is a cervical vertebrae, not a thoracic, not a lumbar? Okay? The easiest way is, you see the spinous process? End is what? Split. Did you notice that? Divided. The end of the spinous process is what? Split or divided or bifurcated, we say. Okay? So this is only in cervical, not in thoracic, not in lumbar. Make sense? So if you see this, this is C3 to C7, one of those two. Another thing to identify cervical. In transverse processes, you see foramen called transverse foramina. Very nice hole in the transverse processes. So these two things are only present in cervical. Make sense? So if you see these two things, these two features, this is a cervical vertebrae. Okay? This is a thoracic. You have 12 thoracic, right? One of those 12. They are very similar. How you will know this is not a cervical, this is a thoracic? You see here, again, spinous process is pointed. The end is what? Pointed, not divided. Long and pointed spinous process. Is it clear? Like the nose of the elephant. Okay? It looks like that, right? Okay. And lumbar. You see, this is a lumbar. Big, right? But big and small is a relative term, right? If this is, I say, only by looking the size, that is not right, because if it is a vertebrae from a small person, right, it will be small. So we should not see that which one is big, which one is small. We should see the features. So this is lumbar. Why? Because again, spinous process. You see, the spinous process is not pointed. Make sense? It is not pointed. It is short and wide this way. Make sense? And blunt. So this is what? A lumbar. Make sense? This is what? A thoracic. Right? This is what? Cervical. Again, cervical has divided, split spinous process, right? And transverse foramen in the transverse processes. Is it clear? Cervical. Thoracic, long, pointed spinous process. Make sense? And lumbar, spinous process is short and wide this way, right? It's not pointed, blunt. Now, the size, as I told you, the size we should not really see because we don't know it is from a big person or a small person, right? But that is the last thing. If I compare these three, of course, you see lumbar is much bigger, right? And heavy. Thoracic is smaller than lumbar but bigger than cervical. So as you go downwards, the size of the vertebrae get what? Bigger. It makes sense because body weight, as you go downwards, the body weight pressure on the vertebral column increases, right? So the foundation should be stronger than the top part, right? So it makes sense, right? The body weight, as it goes downwards, pressure increases, so you need bigger, stronger vertebrae. Okay, so now, if you go we'll see a couple of abnormal bending of or conditions of the vertebral column or spine. Scoliosis, kyphosis, lordosis. If the vertebral column or spine bends, that are the abnormal curvatures of the vertebral column. Scoliosis is sideways, like this. Okay, so first one, you see, vertebral column is not straight, curved this way, like this is scoliosis. Make sense? Or this is scoliosis. Middle one is called kyphosis. If the vertebral column is curved this way, like this, more, that is kyphosis. Usually happens in the upper part, thoracic vertebrae area. Okay, so like this. You will see the back is like more like this. Okay, the back, it's like bump in the back. You remember the cartoon I saw, I don't know if you know, Quasimodo, Hunchback of Notre Dame. So hunchback is kyphosis. Make sense? And lordosis usually happens in the lumbar area, lower part. If it's pushed forward like this, that is lordosis. Okay? So look at me now. This is what? Scoliosis. If the upper part usually happens like hunchback, kyphosis, right? And if like this, that is lordosis. Okay? So those are usually developmental disorder, but that can also happen after birth. Now, another clinical condition that is called spina bifida. Spina bifida or bifida. Very simple, its name is telling you. You remember this process is called what? Spinous process. Remember that? Spinous process. Bifida, bifided, divided. Now, sometimes what happens, you see, the vertebrae, when it is formed, it is formed from 2 points, and each half is formed like this. So from 2 points, the formation of vertebrae starts and then fuse in the midline. Make sense? Now, this is one half, this is another half, and what happens? These two fuse to form the spinous process. Make sense? Now, if that fusion doesn't happen, then what will happen? It will remain separated, right? Like this. And the gap will remain there. Make sense? So, spinous process is not formed by fusion, there is a gap. So if it happens here, now you will understand. If like a number of spinous processes were not fused, then this part will have a slit. Make sense? Gap, like this. And through which the spinal cord or the covering of the spinal cord, which is called the meninges, the covering, okay, can come out. Make sense? Through the back. Make sense? Because there is a slit or opening there. And if the spinal cord with its covering comes out, that is more serious. Because in this case, you see this is the spinal cord and this is the meninges covering. Both came out. That is called meningomyelocele. If the spinal cord remains in the vertebral canal, only the covering comes out, pops out. That is less serious. Make sense? Because spinal cord is still in its right position. Only the covering part came out. Okay? That is called meningocele. So meningomyelocele if both come out, and meningocele if only the covering comes out. In both cases, you might need surgical procedure to fix it, right? Surgery to fix it. So those are few abnormal or clinical conditions related to the vertebral column. Okay, so now we will talk about the appendicular skeleton. Appendicular skeleton, you already know that consists of the upper and lower extremities. Okay. First, we'll see the upper extremity. Look at this, everybody. These are upper extremities, right? Makes sense? Upper extremities. So, this part, you see, the shoulder area has two bones, clavicle in the front, and this is called what? Scapula, shoulder blade, right? So these two bones join together here at acromioclavicular joint, because this is called the acromion process or acromion, and this is clavicle. That's why this joint is called acromioclavicular joint. And these two bones together form the pectoral girdle. So, first you need to know girdles. Okay? You have two pectoral girdles and one pelvic girdle. Look at this again. These two are what? Pectoral girdles. Make sense? Two pectoral girdles. You know, pectoral means what? Chest, right? So, if I ask you, a pectoral girdle is formed by which two bones? Clavicle in the front, scapula in the back. Make sense? And they join here. You need to know where they join. This is the only joint between these two bones, acromioclavicular joint. Okay? If this joint is dislocated, if the joint, gets dislocated, then what happens? Your shoulder, this part will drop down a little bit. Make sense? Because you see here, the scapula is attached to the clavicle here. If dislocation occurs here, then this part, this side of your limb will drop down a little bit, will move down a little bit. Yes?
Can you write down the joint?
Name of the joint? Okay. Yeah. So that is called dropped shoulder. Makes sense, right? So if you see someone's shoulder, one side is like this, that is what? Dropped shoulder. Okay? Due to dislocation of this joint. This joint is called what? Acromioclavicular. Acromioclavicular joint. Okay? You remember I said before that most of the joints are named after the bones or parts joint there. Why this is called acromioclavicular? Because this structure of scapula is called acromion. You need to know that. Acromion. And this is clavicle, right? So acromio, we just add O in between. Acromioclavicular joint. Okay, so that's the pectoral girdle. How many? Two. Okay, this is one, this is another. Okay? Pectoral girdle does what? This part. Holding the upper limb and attaching the upper limb bones to the trunk of the body. So this is the part, you see, this is the part that is connecting the upper limb bones to the trunk of the body. And by doing that, the girdle is securing the limb. So it will not get detached easily. Okay, so that's the pectoral girdle. This is called the pelvic girdle. How many? Only one. This whole thing is the pelvic girdle. Okay, pelvic girdle is formed by two hip bones. These two are called hip bones. Okay, and this is large triangular bone is called what? Sacrum. Remember sacrum? This one. So sacrum and two hip bones. Make sense? Together are forming this part. In both sides you have the hip bones and in the back you have the sacrum. Make sense? So that's the pelvic girdle. Same function. Pelvic girdle is securing the lower limb bones and attaching them to the trunk. Make sense, right? So those are the girdles and the bones of the girdles. Okay, so now let's see. Here we see the acromioclavicular joint. Okay. First, we'll see those two bones, clavicle and scapula. That means pelvic girdle bones. This is a clavicle placed horizontally in your body, right? Like this. Most of the long bones are like this, right? Like this. This one is horizontally placed here. It is also called collar bone, right? In female, sometimes people say beauty bones. Okay? Beauty bones. In case of girls, not boys. Okay? So this is the clavicle, commonly known as collarbone, or in case of females, sometimes beauty bone. Now, this bone has two guards. You see here. Here one, here another, in opposite direction. If I divide this bone into medial 2/3 and lateral 1/3, this is lateral 1/3, lateral. It is concave. Anteriorly or in the front, it is concave. Medial 2/3, if I see, it is convex, like round. Make sense? many ends? Two ends, right? This is scapular end or acromial end, because this is acromion, you remember? Acromion. So this end is the acromial end, forms the acromioclavicular joint, and this end is attached to the sternum. Now, what is sternum? This bone. Okay? So this is which end? Sternal end. Make sense? This is acromial end. So this is the clavicle here, and this end is the acromial end. This end is the sternal end. This is the sternum. Make sense? Okay. Now, fracture often occurs in this bone. If someone falls like forward this way, first bone that hits the ground is the clavicle, usually. Because clavicle is, you see here, the ribs are slightly behind. Make sense here? Then the clavicle. Clavicle is slightly forward, right? So when you hit the ground, this bone gets the hit or shock first. Make sense? So fracture often occurs in this bone. This is a scapula, also called shoulder blade. But if someone asks you, don't say shoulder blade, okay? You are studying anatomy, right? So you should now use the medical terminology. So this is a scapula. Scapula has three borders. Superior border, make sense? And this is the lateral border. That means this is lateral side, and this is the medial border. Let me see here. From the back, this is the scapula. So this border is what? Everybody? Superior. Make sense? This side, superior border. Now you tell me, this is, now look at this. Lateral. Make sense? Lateral means away, sideway. And this is medial, towards the midline. Medial. Make sense? So this is what? Superior border. This is lateral border. This is medial border. Make sense? This is back, right? You understand that this is the back of the scapula. So from the back of the scapula, you see this is important. A bony structure sticks out. See that? This is called spine of the scapula. This is called what? Spine. So if you see the back, you have the spine. Now you see what happens. This is the spine that sticks out from the back, and this spine turns like this and forms this structure. This is the acromion. You remember, forms the acromioclavicular joint. This is the acromion. So basically, acromion is a continuation of the spine. Spine becomes acromion. Is it clear? Okay. And forms that joint. So that is the back. Now, another thing. Look at this. Everybody, this is the spine, right? Remember? Spine. So this area above the spine, very simple, very easy. It's called supraspinous fossa. Supra means?
Above.
Above. Above the spine. That's why it is called supraspinous. Make sense? Then below should be what? Infraspinous. Infra. Supra and infra. Make sense? So how many fossa in the back? Two. Above the spine is supraspinous. Below the spine is infraspinous fossa. Let's see the back. Here. You see the spine, right? Spine becomes what? Acromion, right? And above the spine, supraspinous. Below the spine, infraspinous. Now, two more structures are very important here. You see here, another structure. This is called coracoid process. It looks like the beak of a bird. Okay, that's why coracoid means beak of the bird, you know, bird. So I don't know if it looks like that, but the anatomist, they thought it looks like the pig. So that's why they named it coracoid process. Make sense? And where the head of the humerus from the shoulder joint, this part of the scapula is called the glenoid cavity. So the head of the humerus articulates there, glenoid cavity. This is what? The scapula, right? How many borders? Superior, lateral, medial, okay? So, and this should be in the back spine, right? So which side's scapula is this? Left. Make sense? Because this should be in the back and this is lateral. Remember? Lateral. If I hold like this and say this is right side, what is wrong? This border should be laterally. Because this is lateral border, right? But now it is wrong again. I have fixed that border side, but problem is what? Spine should be in the back, right? So this is not working. This side is not working, right? If I put it this side, all points work, right? You see, this is spine is in the back, and this is lateral, right? Also, glenoid cavity should be laterally because we know that this bone, humerus, fits it. Make sense? So this is the scapula of the left side. And this is the acromion. The spine becomes acromion. And this is the coracoid process, you see? Like big of the bird. Okay, so those two are the pectoral girdle bones. Now if you see the upper limb, this is the upper limb. How many bones you have? 30 bones. Okay? In each upper limb, that means many. So let's see where are those 30 bones. In your arm, this is the only bone. This is called humerus in the arm. In the forearm, how many bones you have? 2. Radius and ulna. This is radius laterally. Now, everybody remember, this is your anatomical position. Remember that? So, thumb side is the lateral side, right? So, that thumb side's lateral bone is the radius. Remember that. Okay? And medial one is the ulna. Okay? So, you see, this is the thumb. This is the radius. This is the ulna. Okay? Those two in the forearm. Now, the bones of your hand, you have many bones in the hand. These short bones, 8 in number here, in the wrist area, these are called carpals. Carpal bones. How many? 8. So, 8 carpals. Then, these 5 are in your palm here. How many? 5. 1, 2, 3, 4, 5. These are called metacarpals. And then finger bones are called what? Phalanges. In these 4 fingers, each has 3 phalanges. So total how many? Each has 3. 12. Make sense? 3 times 4, right? 12. The thumb has 2. So add these 2, 14. So 14 phalanges. Make sense? 5 metacarpals. 8 carpals. 2 forearm bones, radius and ulna. And 1 arm bone, that is the humerus. Make sense? So those are the bones of your upper limb. Let's see a humerus. This is the humerus, largest bone of your upper limb, not the body, whole body. Largest bone of the upper limb. This one. This is the upper end. This is what? Lower lower end. Makes sense, right? This is the upper end, this is the lower end. And they are connected by this part, right? This is called the shaft. Okay? So it has two ends and a shaft. Make sense? Now let's see the upper end. This nice, smooth, round structure is called the head. Head. Okay. Okay, so this is the head. Around the head you have what? This is the neck, right? So around the head you have neck. Makes sense, right? Now, this bone has two necks. How many? Two. One is called the anatomical neck, just around the head. So this is the anatomical neck here, this area, just around the head. And where the upper end joins the shaft here, that is called the surgical neck. So this is the surgical neck, and around the head is the anatomical neck. Is it clear? Why this is called the surgical neck? Because fracture occurs in this area most of the time. Okay? Most of the time, what happens? Fracture occurs in surgical neck area. Okay? That's why it is called surgical neck. Need to do surgery to fix it. Okay. Make sense? The last thing, in the upper end, you have two round structures. These are called tubercles. Tubercles. The larger one is called greater tubercle. Smaller one is called the lesser tubercle. Okay, so let's quickly review. This is a long bone humerus, right? It has how many ends? Two. Connected by shaft. In upper end, you have a nice round structure, that is the head. Just around the head, you have a neck, right? This neck is called anatomical neck. Make sense? And where the upper end joins the shaft, this area, that is called the surgical neck. Okay? And how many tubercles you have? Two. The larger one is called the greater tubercle. Smaller one is called the lesser tubercle. Make sense? Okay. Now let's see the lower end. One more thing. The upper end, the head, articulates with the glenoid cavity of the scapula. You remember? This is the glenoid cavity of the scapula, so the head fits there. Now there is a problem. Glenoid cavity, if you see here, this is the glenoid cavity. It is kind of, shallow. It's not very deep, right? See, it is shallow, flat. So the head forms shoulder joint here, you see, but the head doesn't really go inside it because it is flat, not deep. Make sense? So loosely attached here, not secured strongly. Make sense? Because the glenoid cavity is flat, shallow. So if I pull like this, your hand strongly, what will happen? The head will dislocate, come up. And that happens a lot, right? That is called shoulder dislocation. In sports, very often that happens, right? The head comes up. Okay? But don't try to push it back. Let the people who are trained to do that. But treatment is you push it back, okay? And then, keep it fixed for a while. Okay. So upper end forms the shoulder joint. Now the lower end, you see, lower end articulates with the radius and ulna, right? Makes sense. So in the lower end, you have two structures. You see here, this part is round, that articulates with the radius. This part is kind of rectangular for the ulna. So radius here, ulna here. This round structure is called capitulum. Round part is called the capitulum. Here. And this rectangular part for ulna is called trochlea. Okay? So you need to know all these names. Those are I'm mentioning in your lab too. So this is actually very helpful lecture for your lecture as well as for your lab. Okay, you'll repeat the same things. You'll see same structures in the lab. Okay, so that is the humerus. There is a test to see if you have any problem in shoulder joint. That is called, this is a simple test called Apley's scratch test. The person is asked to reach the opposite scapula or back of the shoulder in the of the opposite side. So like one through the front like this, you try to reach the back of the scapula and scratch there. That is one. Another is through the back, okay, like this. Try to reach the back of the scapula.